Hi there, so my name's Dr. Diana Tao and I work at the Toowoomba Medical Centre on Drayton Road. And today we're going to be talking about how to tell if your child is sick and if they need to be brought in to see the doctor or not. So the first thing that I always tell parents is trust your gut instinct. So this is something that overrides all the other things that I'll be talking about today. But basically, if your gut instinct is telling you that something's not right, then listen to it, and it's always better to be safe than sorry and get your child checked out. But the other things that I'll be talking about today is looking at just the appearance of your child, looking at their breathing, how to be looking at any concerns about their hydration levels, and so those are some of the things that we look at to tell if your child is sick and needs to be seen or not. So some of the things that you look for in terms of the appearance of the child is you look at their level of muscle tone. So a child who's unwell will often just be very floppy, not have any energy. A child who's unwell will often look not very alert. They might either be a bit drowsy or difficult to wake up, or just not interested in playing, not interested in engaging. Particularly in babies, you're also looking for if they're able to be consoled or not. So a child that's just irritable, grizzly, crying, unable to be consoled or comforted, and also sometimes listening to the quality of their crying. So sometimes is it a very loud distress cry or is it a very weak cry and they're not actually able to produce a good proper cry. So those are some of the things that we look for in the appearance. The other thing that you look for in a child is how they're going with their breathing. So some of the signs that we'd be concerned about is if there's an audible wheeze or abnormal sounds when they're breathing. So there's something called stridor as well, which is a sign that you definitely want your child to be seen at pretty quickly if they're having any abnormal sounds with their breathing. Also, you look at if they're working hard with their breathing or not. Are they breathing very quickly? Are they struggling to breathe? And so in babies, we look for things like if they're grunting, if they're having flaring of the nostrils, if the skin at the neck here is getting sucked in when they're breathing, sort of like this when they're breathing. Or you look also at the skin in between the ribs or the skin around the tummy. Are all those muscles being used and all that skin moving? And those are all signs that your baby or your child is working very hard with breathing, and they need to be seen quite promptly if we see any things like that. So the other thing is you're also looking at the colour of the child, and so if they're pale or mottled, then that's not a good sign. Or particularly if a child's had some vomiting or diarrhoea, they can be dehydrated. And so the important things to look for there is if they're looking very dry around the mouth or tongue, if a baby's having decreased urine output or decreased number of nappies. And in babies, you can also check the fontanelle and see if that's sunken. And all of those things combined with the circulation, with the work of breathing, and with their general appearance can help us tell if a child's looking sick or not. But as I mentioned at the beginning, if you're at all concerned, if your gut's telling you something's not right, then please just bring them in and we can have a look for you. If you're all concerned, you can always bring your child in and we can check for you at Toowoomba Medical Centre. You can give us a call on 4635 6111.